Hi, it's Evan from the MindBody Project and welcome back. Thanks for your support and your kind comments. I've got quite a few of them, so I'm very impressed by that. So thank you very much. I do read them all. So thank you very much. This video is going to be on mental health in general, and it's about how our services are in the UK. Because I want to go through, because the title of this video is actually why more money for mental health will not change a damn thing. Yeah, especially the amount of money that they've put across when you actually go through the numbers a bit more of what's actually going on. So what I'm going to do, this is going to be a bit of a longer video, so the first part of this I'm going to go through some numbers with you. Which is going to be slightly boring. I'll try and make it as entertaining as possible, but then I'm going to explain why that's important later on in the way that I'm constructing this video. I am going to come up with some solutions later, what I think should happen. Obviously the NHS has announced, or the government has announced, an extra 20 billion for the NHS. And a lot of that, well, some of that's going to be in the mental health realm, which is a good thing. It's always a good thing, but it's not enough, and there are problems. And putting money into a system that doesn't work is like 0 times 10 is 0, so 0 times 100 is still 0. You're still not getting the outcomes that we need to get. And I'll explain why I think this is not really going to work that well, but I'm going to explain what I think should happen and how you can take full responsibility of your own health so you don't have to go through this system. So the first thing, let's go through the numbers. We have a massive problem in the UK regarding especially anxiety and depression. So the population in the UK is 66 million, 66.85, but I'm just doing 66 million. Now apparently, according to the stats, it's 1 in 6 people have anxiety, depression each week. Yeah. So that's 9.9 million people, and that's just anxiety and depression, by the way. So this is like I'm trying to make these figures not sound as bad. Yeah. So the IAP referrals, so the IAP is improving access to psychological therapists. You may have seen these now. The doctor may refer you off to CBT to go and do something. So it's just making sure that people can access the services easier, even though it's really hard to access them, which I'll talk about in a second. But the referrals was 118,000, let's say 119,000 in 2016. Yep. Not helping the amount of people that we need to help. And there's a few other problems with it as well. So for anxiety, it takes between 3 and 48 sessions. Yeah, using this method, using the CBT. For phobias, it takes between 6 and 24 sessions using this way. And for depression, it takes between 6 and 20, but relapse means that you keep going back. So that could be anything. And the problem is as well is that this only helps, when you go through this, only 46% of people are being helped. Their target is 50%, by the way. So 50%, and it's called a reliable recovery. Whatever that means. That's just a word for, yeah, all right, they can live. That's what that really means. Yeah. So it costs what? Low intensity, and this was 2016, by the way, so it's going to cost more than this now. So it's £1,043 for a low intensity. So that's how much it costs to take them through that. High intensity, 2,895. So this was 2016 though. So these costs are higher. So this is per person. This is what this costs. And when you take them through this, yeah, these 46% of people who are helped Yeah, the 46% of people who were helped out of this lot, 118,000, is 53% of those relapse within a year and 79% within the first 6 months. Yeah. So basically less than half of this is getting really helped out of the 9.9 million that need help. That's how it is right now before this funding, which I'm going to talk about in a second. But the other thing as well, just a few more stats, is that 84% of carers, so the people who are looking after these people, have stress. 84% of carers have stress. 55% of carers suffer with depression. So the people who are looking after the people with depression have depression. Yeah, I'm going to talk about this later on. And then 78% of carers suffer with anxiety. Yeah, I'm going to talk about congruency in care later on. But these are just important stats for now that you really need to hear. So this is on top of, let's say, the cues that you have. So when you go to one of these services right now, if you had depression or anxiety right now, you go to your doctor and then you'll be referred to one of these services. Yeah, depending on the severity, it might be a low intensity or high intensity, or you might see a psychologist or whatever. That may take you longer, but that's around about 6 to 8 weeks minimum. Yeah, 6 to 8 weeks minimum to see these people. Now you have a mental health issue. Yeah, depression or anxiety, or whatever, you have to wait 6 to 8 weeks. Yeah, that is a massive issue. And some people 2 years. Now, most of the time, and this is with the young people especially, they have to be transferred to a different county or a different city to actually receive help. I was speaking to a family link worker the other day who says that in London, where he's from, in his borough, they've got two CAMS workers, so that's the Child and Adolescent Mental Health Services. 2, and there's 400 children waiting to be seen. And they're going to use this method to do it. This reliable recovery rate, where you're going to probably relapse and you're going to be on the end of the queue. So if you think about it like this, it's like spinning plates. This whole system is like spinning plates. So spinning plate there, we're seeing someone, right, okay, we're seeing someone else, we're seeing someone else, right, now this person's come back. Damn it, I have to sort this person out again. Now this one, oh, okay, now I've got a new one. So it's just building on top of each other. So there's just a queue of people just building and building and building on top of each other, which is a problem. Now, who benefits from this? Why is this system like this? Who benefits from it? It is the stakeholders. Health is really a business. Yeah, this is the reason why this ain't going to change a damn thing, because the people at the top make money off health. It's a business. They ain't curing nothing. They don't want to cure stuff, because if you cure stuff, you lose money. So they want you as a customer for life. The more drugs they can sell to you, so if they have side effects, the more money they make. And it's what they're trying to do now is solve non-drug problems through drugs. So what I mean by that is you've got incidences where obesity, so rather than okay, let's lifestyle change, or if there's someone overweight or something, it's now to do with drugs. It's the one that really annoys me is this oppositional defiance syndrome, which is basically when a child says no to their parent. It's now, oh okay, we can give them a drug. It's literally just creating things, and they're sitting around a table making up stuff for a DSM book which has a list of disorders and things, which they can just say what's wrong with people, so they could give you more drugs for it. which don't work. Yeah, so it's a massive con and it makes a lot of money. Now, rather than becoming a health service, because this isn't a health service, this isn't become that now. It's now a disease management service. That's what it's become. And even the changes proposed, which are, let me just find this for you. So the changes proposed are, so for adults, you're going to have new integrated models of primary and community health care, which give 370,000 adults and older adults with severe mental illnesses greater choice and control over their care. Okay, so you've got extra 380,000 people per year will be able to access the NICE approved IAP services. And then what they're going to do as well is the 111 service is now going to be the universal point of access for people experiencing mental health crisis. You'll go through the 111 service and then they'll decide where you're going to go to. Yeah, from there, depending on what you say. Now, I've had to use one of those like literally about 5 days ago. And what you do is you phone up and you've got someone reading the screen and then they will get back to you later. Literally, it could be an hour, 2 hours, 3 hours. And it's like, it's literally the middle of the night. It was like, wow, this is just... So that's how it's going to be. I suppose it's better than nothing. It's an improvement on what it was, but it's still not dealing with all this. And they're also helping out the children as well. Let me just bring that up. So this means, 345,000 people, children and young people aged 0 to 25 will be able to access support as well. So that's essentially what's going to be happening. And it's an extra 2.3 billion, but 10% of that is going to be spent on mental health, which is essentially, and this is per year, which is an improvement again. Let's give credit where credit's due, which is an extra 69,000 children per year is going to be helped, 74,000 severe mental issues with adults, and 76,000 IAP referrals each year are going to be able to helped. Again, you take this number from these numbers, and I've basically said this is 150,000. Let's say it's 2019. Let's say that's moved up to 150,000. You're still 9.5 million people to help with this. Yeah, even with all that extra funding. As I said, it's more of a disease management service. It's these things here, and I've spoke about these, and I've researched these to death, and I know how to do things with these. Especially depression. Depression is a lifestyle condition. It's not like, in fact, I think that everything that you do with your body, if you have any illness, then I would look at what you're doing. Mental, physical health. Yeah, what are you doing? What's in your environment? What are you eating? What are you drinking? That's how I look at things. If something happens to me, if I become ill, I look at what I've been doing. But we'll come more onto that later. But these things here are not going to be helped by the methods that are going to be introduced. Yeah, because you still need to be aiming for lifestyle change. The other problem we've got, the reason why it's not going to make a damn difference, is because limiting beliefs. We have doctors who do not believe that a healthier lifestyle can prevent up to 90% of these illnesses. Yeah, you've got doctors who don't believe you can reverse conditions through healthy lifestyle and aggressive nutritional strategies. Yeah, we still have that. We're still being, they're still being trained in a certain way where it's about what drugs you can give out. Yeah, it's about what does this drug do? Oh, it does this. Okay, you give the person that. Most of the doctors don't believe you can get rid of mental health issues. I was sitting there the other day and someone told me, yeah, you can't get rid of bipolar. I was like, well, who told you that? They go, the mental health person. I go, why do they have a job? What is their job? Job is to get rid of mental health issues. So why are they there? They shouldn't be there if they can't do that. If they believe that, don't work there. You shouldn't be trying to help people you don't believe you can help. Imagine going to go and get your car fixed, and you take it there, and they go, yeah, we don't fix cars though. So what are you there for then? We just don't believe you can fix cars. Well, why do you have a garage then? You just wouldn't take them there, would you? You just take them somewhere where they believe you can do it. It's a massive issue, and that's because of their training. If you look at right now, a GP referral course, get your phone out, get your iPad out or tablet out or whatever, and just look up GP referral training universities. So look up some university courses and find out exactly what modules they're doing, and it will tell you what they're going to get taught on the course. It's nothing to do with lifestyles. So that's why they don't believe that lifestyles can actually change these health behaviors or help with these diseases and illnesses and whatever. Yeah, it's annoying to me. The system, like I've just been mentioning, the doctors are purely trained on drugs. Average of 9 hours training on nutrition. 9 hours training on nutrition, and that's a day's training. Yep, that is why you don't believe you can do things. No training on physical activity, no training on mental health. 1 day first aid course. I went to it's on the first aid course, and apparently the staff knew more than the doctors first aid, because they've literally had 1 day training. They have that every year because they're not even trained to do that. What? This is incredible. And why is this all the same? Because the drug companies fund all of this. They pay money, so they dictate what training is. Yeah, I'm going to talk about more of that in a minute, but that is how it is. And nurses have 4 hours training on nutrition on average. The system is rewarded for failure. So right now there's going to be an increased funding for the NHS, and there are obviously going to be people, there's more people, more population, more people living longer, so there's going to be an increase in people, so there is going to be an increased demand on the NHS, which is fine. But what's happening is that these relapses are happening, and it's not, see, the thing is, I'm not even blaming the frontline staff or even their managers. I'm not blaming any of those. I'm blaming the people who make the decisions at the top. Yeah, because the frontline staff know all this, but they're not allowed to do things. You have doctors who are not allowed to actually advise about nutrition because they might get fired, they might get put in jail. So they're not even allowed to tell you this stuff. They're not allowed to tell you, right, go and do an aggressive nutritional strategies, go and see a functional medicine doctor and do this. They're not allowed to tell you this because they could get fired and put in jail for it. This system is rigged, and it's rigged to make the people at the top money. Yeah, it's an absolute disaster. It's not fit for purpose, and it's obsolete. So the other thing is as well is treating symptoms, not causes. We ain't going to do something that dumb, are they? They're not going to they're not treating causes, they're not curing anything. Why are they going to cure something when they can make billions and billions and billions and billions of pounds each year from you becoming a customer for life? Yeah, what's the last thing they cured? What's the last thing that's been cured? Disease. Have they cured anything in the last 25 years? No. They don't. What they do is they will make it so that you feel an effect, which is, by the way, a very, 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 what's the word? Deceptive word. Very, very deceptive. How do you see effective in the world? I don't know. How do you hear effective? How do you feel effective? How do you taste effective? How do you smell effective? So in other words, you can't really perceive effective, but everything is effective, shown to be effective. Yeah, it's just a massive con, and it's very good with your words to make it look good, so that you can say that you've got some research behind it. Yeah, it's a con, and people are getting caught out because they're conditioned to be like that, because that's the way it's always been done. Yeah, so treating symptoms, they're not going to cure anything. Yeah, nothing's going to be cured. So it's going to really be up to you, which we'll talk about in the solutions. The flaw of scientific research on individuals. Right, I'm just going to wipe this off now, so we've finished with this part. So all of this, we're being told we can't use any of the other things at work because you can't measure it. Yeah? So this is what we're being told. So let's have a look at this. Right. So you've got things that you can measure over a population. So things about humans that are similar to each other. So we have similarities. But we also, as humans, have differences because we're unique. I'm going to put unique there. So what science does, or the way that they're trying to, the government's trying to run things, and it isn't even the government that's running things, by the way, and I'll explain that in a minute. But what they're trying to do is they're saying, right, we can only, our key performance indicators, because we need to do a population, so key performance indicators are things like, let's say, weight. So we can do things like weight, because everyone has a weight. We can measure BMI, that's across the board, which is body mass index. Your height, we can measure. Yeah. And things like that. So things that you can actually measure. So these are the only things that they measure. Well, they don't measure, yeah, because now you're going out the realms of science, is you don't measure your opinion, yeah, your goals, what you actually want when you come there, yeah. So your goals, your opinions, your goals, what specifically you've been up to, what behaviours, what you've eaten. So all of those type of things here are not actually taken into account. Whereas me, these things are 90% of what I'm looking at, and this is 10% of what I'm looking at. This is first, yeah. Then I will take things that you can measure and put them there. That's the focus there. It's unique. Because you are unique. You're not the same as everybody else. But science assumes that you are. You're exactly the same person. So that means they can do exactly the same methodology and exactly the same thing. So something like this, was it Hildegard's lab? So this is, what they were trying to do is measure that certain people are suggestible when it comes to hypnosis, and other people are not suggestible. Yeah, and they scientifically proved that this was the case. Yeah, so how did they do it? So when you look at the methodology, you realize, hang on a minute, this is just nuts. And this is why you need to use the right tools for the right job. Yeah, rather than trying to use one tool for everything, because that's just stupid. So what they done was they basically had a tape. They had a tape player in the room, because you can't have another person there, because now that's, you're coming over here, your voice tone, which is another thing here, voice tone is over here, which is different. My voice tone is different to anybody else's. Yeah, so if I speak to someone in a certain tone or gestures, that's all here, differences. Yeah, so they had to get that out of there. Put a tape on, and the tape was playing an induction. And therefore, some people went into an altered state and other people didn't. Okay? What's wrong with that? Anyone who's studied hypnosis knows that you have to react to the person who is there. You change your induction, you check, adapt, and it's near enough you're going off what responses you are getting from that person. A tape can't do that. And that's the difference between a scientific thing on a human and actually a human on a human, but just not having science there. So it's very different. Because I've heard some there's going to be a difference if, like, I'm sitting there listening to a tape and it's going, I want you to get deeper and deeper and deeper and relax. If I say that and I was just reading out the words, are you going to be able to relax doing that? I've actually heard people doing hypnosis inductions like that who did not know what the hell they were doing. So this is a massive difference. If you're reading a script and you want to go into a trance and you start reading it out like that, then all of a sudden that's not going to work. So this is just a way, measuring it science or non-science is really losing your head and losing your mind and not really focused on the bigger picture. The bigger picture, when people come into get some help with anxiety, depression or phobias, is you either can do things or you cannot do them. And it's that simple. Yeah, I don't care what science or non-science, blah, blah, blah. Can you help me? Yes or no? Is it going to go away? Yes or no? That's all people are after when they come in. That's what their goals are. They're going to come in like that. So stop messing around with all how you're trying to prove research to get funding for this, that and the other. People want results. They want to change. They want to stop suffering. So stop messing around with this, trying to prove things in a certain way. The people will tell you, they'll give you the feedback. They'll give you the feedback that you need and take the information from the feedback. Oh my God. Right. So that's, right, we're taking care of that. Another thing is, right, think tanks. So think tanks are really companies, this is another con as well. So look up lobbying, how lobbying works. Essentially you got like companies, like billionaire companies, what they do is they make something called think tanks up. So they all get together and they create a non-profit company where they can go to the government and go, listen, we'll write your policies for free and we'll do your research for free. And the government's going, what? Really? Yeah. So we'll help with all of that. But here's the thing. Usually it's the drug companies and they are not going to research anything. That's their competitor. So this is why you don't see the government really throwing out their aggressive nutritional strategies, these omega-3, vitamin D, getting all of this flooding every single place out. They're not doing that. They're putting a little bit out there, bit of research on there and that, but look at the adverts. Look at the adverts on TV. What do you see? You see drug company after drug company after drug company, junk food after junk food after junk food, all on there. Yeah, so it's the think tanks basically say, we're going to do this for you and we'll write the policies for you. Notice how all of a sudden the cannabis oils all of a sudden in the shops. Why? Because now the drug companies can make money out of it. Before they couldn't, because marijuana is a natural substance. But all of a sudden they went, right, okay, so if we take away the THC, put the cannabis oil in there, now we can sell it as a package, now we can make money from it, and now we can do the research on that. See how quickly that come across, because it was on the news? Once they can make money off it, then it'll come out. Anything that's natural, like turmeric, and telling people to have turmeric and things like that, and garlic, and anti-inflammatory things, they're not going to tell you that because they don't have to. They don't have to write in policies. It's all about drugs and them making money, but they're helping the government and essentially running the government's health policies for them. So that's another reason. Not aiming high enough. The goal is to get rid of depression and anxiety and phobias. It's not to sit there and actually let people live with it or give them coping skills so that when they get anxious they can do something. It may work in the short term, but the actual goal is so that you don't have to think about it anymore. People don't want this. People want to go in there, with a service and come out, hey, it's gone. Now I can go on and live my life and go and enjoy it. That's what people want. That's what you need to aim for. Short period of time so it doesn't relapse. That's what people are after. Right. Now, lack of congruency. I've mentioned this earlier when it comes to carers, doctors, and all health professionals. When I do for example, a fast phobia cure with someone, I do the technique in my head at the same time, and I go first. I lead the way. Yeah, so I have all my green drinks. Everyone takes the mick at me with my green drinks and smoothies and things. But I know that I need to feel good, because then I can sell it off to other people so that they can feel good. So I go first. You have to walk your talk. Many people do not do that. You've got people out there who are depressed helping other people with depression. You've got people out there who have anxiety and phobias helping people with anxiety and phobias. How are they supposed to get helped if you're not congruent enough to do it yourself? And one of the things in NLP, when I was doing our training, you are not allowed to help anybody else with anything unless you sort out your own issues. Yeah, until they're gone. Until you know how to get rid of your own issues, you don't help anybody else. And that's the way I think it should be. So congruency within staff, that needs to happen. And the last thing here is, I've already mentioned it, target obsession or obsessive disorder. Stop with damn targets, man. Because like you're so obsessed with them, you're actually forgetting why you're doing it. It's like, oh, let's measure this, let's measure this. People are not really thinking straight. What's that aim? What's your purpose for putting the targets in place? Yeah, you want to measure stuff so you can manage it. That's good. But you want to make sure that you're actually getting the targets and the goals and this part, people's individual goals. People want to individually change. They want to get rid of depression, anxiety, phobias, and other mental health things like bipolar. They want to go in to see the service and come out and it's like, yeah, it's gone now, I'm fine, and move on. That's what essentially you're aiming for. So remember that when you're setting these targets, and rather, I don't want to see crap like, what is it? Yeah, you were on a 3, but now you're on a 5. So that shows we've been effective. What the hell is that? That's not a result. And if you think that's a result, then you're not aiming high enough. Yeah, that's not a result. You either, as you said, you either can do things or you cannot do things. You either have depression or you don't. Yeah, is it gone? That's what you should be saying. You should say, is it gone now? That's what I say when I have my services. It's like, anxiety, is it gone yet? Well, let's test it. Try and get anxious again. I want you to get anxious. Come on, I want you to do it. How do I make you get anxious? Well, it's gone, it's gone. That's what it should be. Was it phobia? It's like, right, let's do a test. Let's grab that spider. You should be able to grab it now. It should have gone. That's what you're looking for. That's a result, not the other stuff like naught. Oh, it was a naught, now we're on a 5. That's not a result. That's just a way for you to be target obsessed and like show funders that you're doing really well when you're really not. That is why there's a massive queue on mental health at the moment. That's why you've got so many different people who can't get helped. It needs to be resolved. And if you put more money in it and you're still doing the same things, then don't expect anything different from what we've got now. So that is my rant. It turned into a rant. I didn't really mean it to be a rant, but that is why it needs to stop. And you really need to think about what you actually want seriously out of this. Yeah, because you've got to ask people. You're sitting there on this side trying to get things science way and target obsession, show funders that you're doing well, when really on this side everybody's suffering because you're not actually taking their opinion, their goals, what they're doing, their behaviours, and doing things to help, not only help them, but help the staff. Your staff's mental health is, your client's mental health is as good as your staff's mental health. So if you're not looking after your staff, how on earth are they going to help anybody else? How are they going to help anybody else? You can't, because you're not congruent. You can't do it. So you need to start, those people who are running these things need to sort your stuff out, because you're not doing it properly. You need to listen to your staff. Yeah, they're the ones who are telling you things. They've got the idea. So just listen to them and actually start changing it around so that you're starting to take this into account. It has to be taken at what people's uniqueness. Yeah, and then 10%, yes, you measure stuff. Not flipping 90% measuring stuff and 10% with a change, which some people actually go after. Some directors do go after. They say, well, look, as long as we prove things on paper, then the funders will be fine with us. That's not going to change. Is that your mission in life? Just to con people? That's just a con. Just to make money. And then we need to change that mentality. So that's the reason why. And what I'm going to do on the next video is I'm going to come up with my ideas of what we can actually do to change this around. So I'll see you on the next video.